In the past, if you had a mental health problem, it often took a while to get treatment. First, you had to visit your doctor, then wait for a referral to a specialist for assessment. Only after that would your treatment begin. All that could take a long time. In Barnet, Camden, Enfield, Haringey and Islington, we are now working closely with GPs, local authorities and the community so that you have access to specialist support faster. This means you'll get quicker access to health and social care. And as part of a new major step towards improving access to our services, we will aim to begin your treatment in 4 weeks. This is the result of changes that we began planning several years ago. They're part of the largest changes in community services in decades. Our new teams are made up of staff with different skills and from different organizations, all working together. Our thinking is now more joined up. We see ourselves as one big team working with GPs, community, charity organizations, community groups, and adult social care. The link between our staff and the voluntary sector is important because they work with people in their local communities and know who might need some support. Now you can access help more easily when you need it. We know that people may not have had the best experiences with NHS mental health services. We've had open and honest conversations with the public, people who use our services, and carers of those we help. We have heard what people have said, and that's why these changes are being brought in. They're some of the biggest in the past 30 years. They mean that we'll create a care plan with you called Dialogue Plus. We'll talk to you about how you are feeling, the factors that are contributing to that, and understanding the outcomes you would like. This helps us to work out what we can do together to make things better for you, to help you on your road to recovery. There's also more support for people in the community who no longer need our care. And there are services for young people moving from children to adult services. There's also increased support for older adults. As part of the care you will receive, there is a greater range of help and support we can provide. We realize that factors like housing, employment, relationships and money can affect people's mental health and well-being. Physical and mental health are now more connected. We've taken on new staff who can help make the link between physical health, social issues, and mental health needs. We work with GPs to help you get annual health checks and give advice about issues like smoking and healthy eating. We work closely with crisis services where people can refer themselves for help in an emergency. There are now support groups held in places like libraries. Going forward, we'll continue to develop our support around the needs of our patients, working with the community to meet local needs, and making sure that people in each borough will have access to the same care. We still have improvements to make, but the changes we've made so far mean we can see more people who need our care, faster and closer to home. We can help you to get well, and importantly, to stay well.